think Rosebud's looking really good. She had a growth spurt, so she lost a little bit of weight, but now she looks a little even pudgy. How's she doing?
Her body score went up from a 3 to a 4 now this past year.
And how do you assess body condition score?
We look at her from her withers all the way down her back to her ribs, her hips, and all over her body to check and see how it looks.
Yeah, so it's not just the belly. You know, a lot of times horses will get, young horses will get a little pot belly, and we're going to talk about that in a minute, but it's across here. And we could actually visually see your ribs before, now you can't. What type of feed did you switch her to?
We switched her to more the original safe choice compared to just the sweet feed.
Yep.
We're mixing that in with her, and the rest we've been keeping about the same.
Yeah, so that little bit of that extra along with her alfalfa seemed to make a difference for her. So, but she did have a little bit of a problem just last month. What was that issue?
She developed colic.
What's colic?
It's pretty much a deadly stomach ache.
Okay, yeah, so it affects the digestive tract. And how deadly is it?
It could kill them because of twisting intestines in her body and
Yes, you can have impaction there. So it is the #1 killer in horses. So it's something you got to catch early. What was the sign that we saw? One of the big things that was a problem with her that we ended up calling the vet.
She was laying down. She was biting at her side, uncomfortable. She was just very uncomfortable.
Yeah, we caught her fairly early, which was good. So what are some of the reasons why we might have a horse that colics?
You have because
gastric ulcers.
Gastric ulcers. Sand colic could be caused by parasites also, and also by dehydration could also cause a colic.
Yeah, and so like I mentioned before, you know, she's a little pot belly, but sometimes that could be just the forages you're feeding. She's out when she goes turned out, she get a little bit of round belly, so again that can happen. But that can also be, especially if it gets unconditioned, that can be a sign of potential parasite load. So how did you rule out parasites as a cause of your colic?
We looked at her feces and see if we could see if there was any signs of a parasite in her.
Yeah, and we actually even then did what we call a fecal sample there to look at the fecal, or to look at the parasite load. And again, she was within the normal range. So it's the wintertime. You wouldn't usually think of parasites as the wintertime, but is the wintertime probably the most prevalent?
Yes.
Yeah. So summertime, it kind of kills all the heat does. So wintertime, that can be an issue. Another issue is dehydration. During the winter months, they may not want to drink. How is she doing drinking wise?
She's been drinking a lot through these few months we had her, and
so you can tell the water amount, but how else can you check if a horse is not hydrated?
We can check by testing their poop, make sure it doesn't dry out quick. We can also test by pinching their skin a little bit and letting it go, and see if it's supposed to 2 seconds, it's supposed to go back to normal.
Yeah, so our skin pinch test, or I call it the smoosh test, where we can take and you should be able to smoosh down on that poop. It should be nice and moist, not too moist that we're talking about diarrhea, but also not dry also. That could be a sign there. So no dehydration, she's been drinking regularly even though it's been cold. And then gastric ulcers. Now that's a common, most of your show horses all have it. She's not a show horse, she's a young horse, but she did ship from a long distance to get here. Gastric ulcers. How did we rule out gastric ulcers?
We take a sample of the feces, and then we take it to the vet to have it tested.
And what would the vet look for? It's not parasites. What are they going to look for? It's a new test that's just come out on blood.
Oh, okay.
Yeah, I mean, because is blood good in any feces?
No.
Doesn't matter if it's human or horses, does it? So, and that was pretty interesting to do. They mixed it up and whatnot. So, so that was ruled out. So, what was the final one that we finally decided on? The vet decided that was the reason why.
Sand colic.
And how did we rule out what was sand? How do you rule out sand colic, or how do you rule in sand colic?
Well, you take a sample of the poop again, and then you put it in water. And if she has sand colic, the sand will go from the poop, go to the bottom of the water, where you know.
Yeah, it's visually obvious. If there's a large amount and you mix it all up in water and the poop starts to disintegrate in there, but if that sand will go down to the bottom, and if it's quite noticeable, that's not a good thing. So, so that's what we ended up causing the issue. And coming from Oklahoma, that's a common problem. But now, since we're finishing up the winter months, we're going to go ahead, and since she has a little bit of belly, even though we ruled it out with a fecal test, we're going to go ahead and deworm today. So what's my steps to deworming?
So we're going to hold her.
Okay,
here.
I'll hold her here for you, and she said, uh-oh, something's not coming up. And then how do we measure how much dewormer we should give?
By her weight.
Okay, and the last time we've been practicing the weight tape with her. She was real skittish at first, and we've been practicing with that. So that desensitization activity worked out really well. So we're going to put this weight tape over. Won't give us an exact measurement, but it'll at least help us for kind of figuring out an estimation. And about what weight is she at? She's gained a little bit of weight. She was around like 450 last time. She might be up at a little bit up 5 about now.
Yeah, around, I want to say 490.
Yeah, so about 500. Okay, so what we're going to do is, here's the dewormer. So I'm going to take that from you, and then you go ahead and you'll see on that dial it has where you go ahead and I'll take the box from you. The different weights. So, and I'll take that there. Okay. So go ahead and dial it. And as you're dialing it to that 500, where exactly are we going to end up sticking in the dewormer? Are you going to take it from the front of the horse's face or on the side?
The side.
Okay. Yeah. Because the horse has in there, and we'll show real quick. So they got incisors in the front, and then the cheek teeth in the back, and so this open area here, and that's where Nick's going to go ahead and do. And I'm going to stand to the side to let him go ahead and deworm her. And then he's going to hold her head up a little bit after he gets it all in there. Make sure that she goes ahead. Oh, she says, and this is the first time we have dewormed her. It is filmed. Make sure she swallows. Good. Yeah, very nice. Good, and so then we'll kind of monitor her and watch her feces, see if she sheds any parasites, and keep track of that. We'll keep her, she's in the stall, so she won't be, if she sheds any, we can go ahead and pick it up and clean it up and kind of monitor her, and that'll help there. We are going to show, so since she went through colic, when they go through colic, what do they typically do to treat them?
We typically treat them by... we started feeding her Metamucil to calm her stomach down.
And that helped with the sand colic too. But what did the veterinarian do? They had a big tube, didn't they? That stuck down. Yeah. And what did they stick in there? Do you remember what they stuck in? It was a lot of water, but the water mixed in with other stuff, wasn't it? Yeah. So, and actually what they did was they ended up having her sticking that tube down in there. She spit some stuff up in case there was stuff that was impacted. And then they mixed in mineral oil. But there was another substance that our other veterinarian said was good to mix in there if we didn't do mineral oil. Do you remember what that was? This is new to both of us, wasn't it? Yeah, it was Epsom salt. So this was new. So we're going to show you in the next videos, we're going to show you the mixing of the two to see the difference between mineral oil and that. And then we'll also test her poop again concerning the sand and see if she's improved on that. So we'll go ahead and show that. But good job, Nick, and look at how calm she's gotten. We've come a long way from her being really head shy and stuff, so nicely done.
Okay, Nick, so what am I seeing here? What are you doing?
The vet came out for a colic and put in a gastric tube down her throat, where she put down in the tube warm water with mineral oil.
Okay, so we're kind of checking what that actually does, and you can see as we're mixing it up, kind of notice that the oil is not exactly mixing up, which is not a surprise because it is oil.
Yeah, you can notice the oil doesn't mix well with feces and starts coming to the top, while the feces balls up in large chunks.
And I can see that in this picture where you can see the oil is kind of the top and then it balls up there. So what am I seeing here?
Another vet recommended Epsom salt instead of the mineral oil, as it dissolves the feces, as you'll see. When we mix up with warm When we mix it with warm water.
Okay, so instead he would recommend using, instead of the mineral oil, the Epsom salt, just because he thinks that would dissolve, or his experience, it dissolves it better and then allows for it to go through the gastric tract because it gets all of that feces not as clumped up. So the oil might kind of help to kind of lube it up to get through, but the actual Epsom salt is going to actually break that feces. So if you're dealing with impaction colic, that would be extremely useful because it's going to dissolve it. So, and you can see in these pictures here, if you look at the first one, that's it mixed up. But notice when you get to the second one, the oil where it comes to the top. There you see to the left is the mixed up versus the right is that oil. It's kind of clumped up. So now what do we have here?
Here we are testing for large amounts of sand in the feces, as we assumed the filly had sand colic.
Yeah, so we figured out it wasn't gastric ulcers or anything like that, but it might be sand colic. So here you see her feces. Notice, again, the feces.
Yeah, you can note the sand down at the bottom once we mixed in the water.
So what do we have here? What are you doing here?
This is Metamucil. We did a scoop a day of Metamucil for 7 days mixed in her feed.
Okay, so now I guess you're retesting?
Yeah, here we are checking again for the feces for sand after the 7 days of Metamucil.
Okay, so what do we see here? The left to the right?
You can see on the left, there's less sand down at the bottom.
Oh, great. Well, it looks like she's doing good. Good job.